I think you're right. Recreate the spontaneity of the phone call, and people will like that.
All right, Brandon. So it's the start of the high school football season, and there's always a topic that ends up coming to my mind whenever it's that time of the year. And I'm curious if you've encountered a similar situation. I saw something on social media about this topic that I wanted to share with you. So let me do that real quick. And I want to get your thoughts on this situation. So we're just going to listen to this gentleman speak about it.
Cramps: potassium, magnesium, calcium, and chloride, vitamin K, and vitamin D to get the calcium where it needs to go. And of course, water.
And it's social media. So you just got to throw in there this whole jumping on the table thing and showing off his calves that are specifically not cramping. But yeah, cramps. That I've consistently found that at the beginning of the high school football season, there seems to be something about kids starting to play those first several games. And I noticed at the JV level, the varsity level, the freshman level, that the first game or maybe the first couple of weeks, a lot of these kids, particularly the skill positions, are cramping. I think there's a lot of opinions that people have about what contributes to cramps, what prevents cramps, how to treat them. But it is a common problem in young athletes across multiple sports. And I wanted to get your thoughts about how you conceptualize muscle cramping in the young athlete population.
Yeah, man, this is one of those where I get really passionate about it because, dude, I was a cramper. Like, I play a soccer game. It was a guarantee. We go to whatever, like, in New Jersey, it was Perkins or Friendlies or whatever little like Cracker Barrel type thing after the game, and I'm the one like both quads are cramping, both hamstrings, calves, like I'm rolling around on the ground. And I think the thing is people talk about, oh, you need to hydrate, you need to get electrolytes. That just doesn't add up to me. And definitely, jump in here if you're, if you disagree with anything. But like I just think we can say with a good degree of confidence that at least the majority of exercise associated muscle cramping is not due to electrolyte issues. But I think it's just something people say. It's just so easy to just be like, hey, get hydrated, drink this pickle juice or whatever. I think there's probably so many things that are associated with exercise, like dehydration, like electrolyte losses, that it's so easy to just say this is related to it, or let me say this is the cause of it. I just don't see that. And here's the reason why. I think one, and I put this out in a post that I've been covering, you cover too. I've been covering for 12 years on the sideline. This generally happened, and I'm in Arizona. So this generally happens the first few games of the year, right? Like kids don't just change their drinking habits, halfway through the season. They're going to do what they're going to do. So I don't think it's that. And it's like, all right, well, why of all times does the cramping start the first few minutes into the third quarter? Like that doesn't add up to me, right? So we're going to say this is the time that you've had some rest, you've had ample time to get fluids, and all of a sudden you're going to start cramping because it's due to dehydration or electrolyte imbalances. I just don't buy that. That doesn't add up to me as the majority of and it's like it's not a secret either, right? So nobody wants to cramp, nobody wants to miss time on the field. They're going to do what they're going to do to try to prevent that. So if you have something that is a known issue, happens year after year, same athletes, and they know they're supposed to drink fluids and take electrolytes, they do that, they still cramp. Like, how can we say, hey, you just need to drink more? I think it's just one of those things in medicine where people just like to, beat the table about something that's really maybe an association, not truly evidence-based.
All right. You framed this really well. So in that vein, you talked about kids know they need to hydrate. They already know it. They've been experiencing it every year. They already know that they need to hydrate. It seems to be happening at the beginning of the season. And I would agree with you. That's when I observe it as well, happening at a higher frequency. When kids are training and practicing before the season starts, to your knowledge, do you talk to the ATCs? Do you talk to the coaches? And are you hearing from them, man, it's the summer, like got a bunch of cramping to get through during camp? Is that something you remember or recall hearing a lot?
No. And that's a great question because it gets at, does the intensity match Like, does the practice intensity and stop and go? Because I think there's something important about halftime. Like, what's happening at halftime to the body that's creating an environment to be ready to cramp in the third quarter. So let me let you finish your thought. But yeah, that's no, people don't talk about that.
Yeah, and that was the reason I was bringing it up. You picked up exactly what I was putting down, which is maybe there's an intensity ratcheting up between your practices before the season starts and that first game. There's a discrepancy in the intensity. But then you touched on another point, which is very important. And I'm assuming what you're saying is, correct me if I'm wrong, the frequency and intensity of the cramping you're seeing in the athlete is particularly noticeable when they're coming back out to play after halftime. Is that accurate?
I would even go as far as saying I rarely, and we're talking football, I rarely have ever seen a first half cramp. That like has the athlete off, the athletic trainers running on, stretching. I rarely have. Yeah, I can't think of a time when I've seen it. It's probably occurred, but I don't know. I don't. I think that's yeah, very little, if any, cramping occurs in the first half, from my personal experience.
Okay, so there might be something we can draw a conclusion for. And I think I'm going to give you my philosophy, which I've already told you before, but I want to give you my philosophy about this later. But the foundation of the cramping paradigm, the way we would observe it and describe it in young athletes who are football players, is the first game, the first half seems to be fine. But after a rest period during halftime and the ratcheting up of the intensity for the second half, that specific situation seems to increase the risk of lower extremity muscle cramping. Is that the right way to think about it?
Yes, that's the premise that we should start with as far as looking at the why. That's the clinical
Okay.
situation.
Okay. So you are seeing it the same way that I do, in the sense that the practices and the training camps leading up to the first game are not littered with repetitive cramping, which means it's not happening in the training environment really that frequently. It is happening very frequently and observably in the second half of the first game or the second half of the second game early on in the season. So something is happening that's not being mimicked during the training period. There's nothing different, right? They're not a different human on the game day that they are training day. So there shouldn't be
Yeah,
any reason you couldn't mimic that environment or mimic the way the flow of the game is. I
but I
think
think there's. Oh, sorry,
yeah, go
sorry.
ahead.
Go ahead.
I think what's happening is that coaches are training consistently. Like they're just getting the kids to they're not like, okay, now cool down. Okay, now ratchet back up. They're not doing
Yes.
that. And I think that is what's contributing. I'll tell you why I think it's doing it, but I think
Yeah,
that's
yeah.
what's playing a role.
I think that's one thing, and I think, we're talking about football specifically, but you can cramp in any sport. But I would say the second is like you can't really simulate the intensity of a tackle football game. Like yes, you can have them go, you can have them scrimmage, but you're not talking about an all out, like every play is an all out effort, taking contact, the fatigue level. Like I don't, you would just risk too much injury on the preseason if you were doing that,
Hmm.
so
Yep.
that's my thought is like, one, yes, you're not doing this up and down, turn it on, turn it off. Hey, we're going to simulate a halftime, we're going to simulate that, and you're also not able to recreate the full intensity of a tackle game purposefully, like right, like too much injury there.
Yeah, I would agree with you 100%. Let me go into what I think is contributing. So the theories are a fluid electrolyte hydration standpoint. I don't think so, man. Um, I think I think it plays a role, but I think the role is marginal. I think I agree with you 100%. Particularly elite athletes, already know how to hydrate, and cramping happens at the professional level. They haven't solved this problem. It's not like they have access to some knowledge that we don't. The professional athletes cramp, and I'll go into why I think they cramp.
The college athletes cramp, right?
The
Like,
college athletes cramp, yeah,
yeah,
and
yeah.
they have access to, like, we can test their urine to make sure they're hydrated. Like they have all the tests available in the world. They have every sort of rehydrating solution. They have intravenous stuff that they can give in the locker rooms. They have everything, and they still cramp. I think fluids and electrolytes don't tell the whole story. These other vitamins and minerals that are mentioned, I also don't think tell the right story. As a brief aside, I think the world is not respecting how amazingly engineered the human body already is when it comes to essential vitamins and minerals. The body has a tight control over magnesium. There's a very specific window of what the body wants to keep magnesium at. And if you don't have an absorption issue in the gut and you don't have a kidney issue, your body will tightly titrate how much magnesium it needs to use. That's an essential mineral, and abnormalities in magnesium can lead to heart rhythm problems, and your body is not going to treat that in some wanton manner. It knows how much magnesium it needs to function properly. So exogenous administration of magnesium seems to be missing the mark in terms
Yeah,
of
I'm not. I think what you're saying is like it's not like that's maybe not. It's just not the main issue, right? Like,
right.
sure, if you want to supplement with magnesium, or you know, in my kind of nutritional stuff, you know, that's edamame, pumpkin seeds. Like,
Mhm.
yeah, you can do that, but that like just taking a little IV hydration drink does not solve your problem. If it did, we wouldn't have cramp. Like we people like at the pro and college level, we just wouldn't have it.
Yeah, well, exactly what perfect. So you've picked up exactly what I'm trying to say. Like the people who have access to unlimited resources haven't solved the problem, which means we don't know what the actual cause of the problem really is. And I think we're getting distracted by thinking it's fluids, electrolytes, magnesium, calcium, etc. The healthy human athletes have healthy systems of managing that. Their kidneys by and large can be expected to be normal. They will know how to titrate those minerals appropriately. And so they're not going to be deficient in those minerals in some way that's going to contribute to cramping.
Yeah, yeah,
So
they
then
could
what
be deficient. They could be deficient. I'll say that. But I don't know that that contributes to cramping like acutely like that. You know, you were good to go before the game started. You know, you do lose magnesium in your sweat. But I think it's just more associative, Arvin. It's like it's just so easy to say, well, you're dehydrated. There's no other explanation. But I think, you know, we both think there is.
I would say that I did see one really good double-blind placebo-controlled trial for magnesium oxide supplementation for people who had nocturnal leg cramps. And that seemed to statistically significantly reduce the rate on on the treatment group of the frequency of nocturnal cramps over time. But I'm not sure that the pathophysiology behind nocturnal cramping is the same as exercise-induced cramping in young athletes.
I agree. I think like, and this, I'm just speculating. Like, I think muscles cramp for multiple reasons. Um, I think the reason why the muscles cramp in an exercise associated reason may be different than a nocturnal muscle cramp, or even like, hey, you're doing something in the gym and, you know, whatever, some hamstring curls and your hamstring starts to cramp. That might even be different. I don't know, but I think it all gets boxed into one, and then we think it's dehydration and electrolyte imbalances when I think there's pretty obvious, you know, evident, not evidence per se, but like anecdotal situations where, hey, I'm in my garage doing you know, working a screwdriver and my forearm starts to cramp. Like, I didn't just get dehydrated, you know, from doing a you know, putting a screw in. Like, so you know, embarrassed to say my arm might cramp, but it's not due to, you know, dehydration or electrolyte balance.
So to that point, I think I can weigh in on what I think is the model by which I think about muscle cramping. So if we think about it as if it's a young athlete who's a football player and they really develop the cramps more towards the beginning of the season, they didn't really have it in training, they get it at the beginning of the season. And then as the season progresses, the frequency of their cramping seems to go away. I think there is a muscular habituation where initially the muscles aren't quite primed to handle the interplay between the respiratory end products of muscle use that they're generating during the first half versus clearing out those metabolites and then bringing in fresh nutrient sources and oxygen. And so you can label it simply as lactic acid, but I think there's probably more at play than just the lactic acid alone. But basically the muscles that are being used are generating these products of muscle use, the end metabolites. It's being cleared by the body because the blood flow is efficient when you are actively working out. So the first half is okay because the way the blood is being pumped through the muscles is allowing it to clear out, and that the frequency with which it's being cleared versus being produced by the muscle is at equilibrium so that you don't get too much buildup. But when you rest during the rest period of halftime, those metabolites build up. And then that's when, as you start to get going again in the second half, the cramping happens because now there's been a buildup of these metabolites and there's been a diminishing in the heart rate because you've been resting. The heart rate's come down, the cardiac output has come down. So you haven't been getting these muscles flushed out, and the muscles have been generating these metabolites still while they're resting. And now you've got a backlog, and then that generates the cramping until you've stretched it and massaged it, and the blood flow has allowed the muscle to kind of clear out the metabolites again. But there's a habituation where this is a problem in the beginning because you're still ramping up to the intensity of the football season. after the first several weeks, the body becomes more efficient during the halftime period or the rest period of generating enough cardiac output to continue kind of clearing these metabolites even while you're resting. So then that post halftime cramping becomes less of an issue as the season progresses. That's the paradigm through which I think about it. And I think all of the other things we touched about, fluids, electrolytes, magnesium, calcium, vitamins, whatever, they may play a marginal role, but for this specific clinical scenario in young athletes, I think what I just described explains it a little better. So my way of thinking of how we should tackle it is maybe you don't have to ratchet up the intensity of the football practice necessarily, but modeling it such that you get your athletes really working hard and then forcibly rest them as if they're going to do a halftime and then ratchet them up again. And it doesn't have to include contact because cramping is not a contact issue. It's a repetitive muscle contraction issue. So sprinting them, resting them hard, and then trying to generate their intensity in a non-contact fashion soon afterwards again and mimicking that during training camp may get the habituation process to happen earlier so that by the time the season starts, you're not really dealing with it because you've sorted through the paradigm while you were training. What do you think? Would you pick that up?
Yeah, I mean, I think that's totally reasonable. And I think when we're talking, we're usually validating what each other is saying. I think I probably have a little different approach, but I think it actually ties into what you're saying. I think there's a couple of things that your thought process also reinforces. If because one of the issues that I had personally and that I see is like, hey, I might be fine at the end of the game, but 2 hours later, while we're at the whatever Culver's getting food, I, I, I go down, I cramp up, right? And so if the argument or at least theory is that, hey, during this rest time, there's this metabolic process that's still occurring, um, I think that is, that fits. One of the things I would throw in there is about not necessarily the rest period so much, but what you would do as far as a preventative. And I think it matches what I would suggest. But let's say I'm maybe this is probably out there and we're just parroting something that's already been being researched. So I don't want to take credit for that. But like, let's say we're talking about your theory is like a metabolic theory, right? And so maybe what you do at halftime is you're doing some low level physical activity to, because lactic acid is essentially lactate. And that lactate can be used as a fuel source, right? So if you can work at a low level of physical activity, like an exercise bike or something like that, potentially what happens is you start to clear that lactate through like a low level, zone two type of work. And that can reduce that milieu in your muscle. I think that's a reasonable thought. You know, what I think is a better explanation is the neuromuscular fatigue theory, and not something I came up with, but my thought is, okay, you you have the same situation, you go into halftime, and at this time the muscles have been contracting forcefully, constantly all throughout the first half. Now the nervous innervation to those muscle spindles is very twitchy. It's very high um, not irritability per se, but high hypersensitivity, I would say. Then you have this rest period where that Golgi tendon that's supposed to work from an inhibition standpoint, where it's supposed to inhibit a sustained contraction or a hard contraction to help you prevent against muscle injury. That Golgi tendon apparatus kind of resets. It's like, I was doing a lot of work in the first half to kind of help you prevent injury, not have an over contraction or a sustained contraction. Now it sounds like you're resting, so I'm going to dial it back a little bit. So now you have this muscle spindle nerve innervation that's hypersensitive. And then you have this Golgi tendon apparatus that's kind of reset. So then you get back out in the third quarter, and that muscle spindle's ready to go. It's raring to go. And then that Golgi tendon is not as primed as it was when you kind of worked your way up through the game. And then you get this kind of imbalance from the excitatory of the muscle spindle and the inhibitory of the Golgi tendon. And that's what may lead to a cramp. And I think it still occurs when the muscle has become fatigued. Like fatigue is what sets that up. But once you have that rest period, that's what really puts you over the edge to go into this cramp. And I think it also explains why, after a game or in the evening, or people wake up in the middle of the night, uh, totally random. I thought I could try out to be the kicker for my college, and I went out and kicked for like 2 hours, had no idea what I was doing. Dude, I woke up that middle of that night, my tibialis anterior was like, I could not get it to relax. But right, like I wasn't dehydrated. It was, it was just a muscle that I had fatigued out, or, created a metabolic environment, either thought. But I think those two explanations have a much better correlation with what we're seeing clinically than does fluid and electrolytes. So I have some more to say on that, but your thought on that.
I think after hearing you speak about that, I might be swayed to lean towards your explanation a little bit better, because I realize the way you described that explains why degenerative motor neuron diseases have a clinical quality of cramping. So if you have, for example, some selective spinal nerve issue, and I think specifically like lower motor neuron pathology, you get weakness and atrophy, but you get cramping of that muscle as a consequence of that. And so maybe what you're saying makes a lot of sense, because if you've got if you've got a mismatch of how the excitatory inhibitory complex works from a nerve standpoint, not because you've fatigued it out, but because those nerves have been lost or the conduction along that pathway has become weaker, that also leads to cramps. So maybe that is a good holistic explanation of why. And it also explains the habituation, where when that entire neural complex becomes better week by week, the frequency of the cramping after halftime goes away.
Exactly. Yeah. Right. That's the thing that to me is like, we see there's a clear adaptation. And the other point that I wanted to make and get your thought on is like, it seems to be the same athletes each year from my standpoint. I'm at the same school every year. It seems to be the same athletes. It seems to be a certain type of athletes that's a more aggressive, high speed, quick change direction type of athlete. So my guess is that it has to do with muscle fiber type as well. Like certain muscle fiber types, type 2 fibers or whatever are more at risk of this occurring if we see it from a either metabolic or neuromuscular fatigue lens. Thoughts?
Yeah, I agree with you 100%. It's generally not the linemen in terms of my experiences. It's usually not even the linebackers, but it's usually the running backs, the tight ends, the receivers, and the DBs, the punt returners. Those are usually the ones I see it in, the ones that are covering a lot of ground throughout the entire game. And I feel like if we use soccer as a paradigm, it's been a while since I covered soccer, but it wasn't usually the defenders that I saw that were cramping often. So I agree. I think it's position based on what are the specific roles of your position in the sport you play. The more you cover, the faster you go, and the all-out sprints that you are involved in is going to increase the risk of you cramping earlier in the season.
And maybe those type of athletes just by correlation have a different set of muscle type, like a different, you know, percentage of fast twitch muscle fibers. You like maybe that's why we see it that way. So in thinking about it, my thought was like, all right, well then what do we do at halftime? And maybe it's that same thing, right? Maybe it's like we don't want, yeah, and I'm kind of paraphrasing here, but like we don't want that Golgi tendon to get reset, right? Like we want it to still be um more active. And so what things could you do there? Maybe that low level physical activity. um what do you think about, like, how do you think stretching, the fact that stretching can improve your muscle cramping when it's acutely occurring, does that fit this notion? Does that fit this theory?
It does, because we know the stretch response has a specific biofeedback to the neuromuscular, or the specific connection between the spinal nerve, the motor neuron, and the muscle spindle itself. There is a stretch reflex that acts along that biofeedback pathway. So I think that it would be reasonable to include in the rest period appropriate stretching, in addition to the other thing you said, which would be like not completely going to rest, basically, like doing
Yeah.
some low level clear out, sort of consuming the metabolite or flushing the metabolites out, if you wanted to use my paradigm, or basically keeping the neuromuscle spindle primed, your paradigm. That, in addition to stretch, should be what addresses this issue.
Or even like a stretch contraction type of thing,
Yeah.
that you're doing. Now, let me ask you this because, and I'll go back to a couple of things we said earlier. Two questions for you. One of the things when I talk about cramps here is like, well, what about like ultra marathon, Ironmans? Like they've seen that uh, 20-30% of these folks are hyponatremic, consuming too much water, not enough electrolyte. There's electrolyte imbalances. Let's just put it that way. So, maybe that is correlative, causative. What are your thoughts on that?
You mean like the 20 to 30% of people who do an ultra marathon who cramp have hyponatremia?
Yeah, it has some like there is explanation for electrolyte imbalances causing cramping in those type of sports. So not your, in endurance sports, like where you're not doing a sprint or whatever.
But
Like,
60 to 70% of the crampers don't have it.
so that was my point.
So
It's like it still fits the fatigue model.
yeah, I would argue that the fatiguing model better fits why they cramp. Like,
Yeah.
uh, and
All right.
the electrolyte fluids bugs me because I don't like it when we come up with too simple of an explanation
Mm,
and we anchor on it. Like, this has to be it. This has to be it. When the evidence is so weak that is like definitely the problem 100% of the time, it just doesn't. It annoys me because I feel like it's intellectual laziness.
yes, yes, yes. Now, another question I got asked about was like, and this is not my area of expertise, so you can pass on it if you want, but it was like basically you've got a kid that's sitting at halftime, like leaning forward, like their trunk is flexed, right? So
Hmm.
maybe when we're talking about this neuromuscular, like maybe there's some tension on the spinal cord, creating so their argument, not argument, but like there was some case for like, could we use like chiropractic or um, osteopathic manipulation at halftime to potentially reduce some of this excitability or hypersensitivity to the muscle spindle. I'm like, I don't know, but I'm so like I was trying to kind of think of like a protocol of like, all right, so maybe you have this stretch, relax, contraction kind of method. Maybe we have some low level RDLs, single leg squat, maybe we're doing some stuff that really can just continue to kind of activate that neuromuscular pathway and not just let it kind of get out of balance. And then, some low level, cardio, exercise bike, that type of thing. I was even thinking like, what if just like periodic jump roping at halftime? I don't want to burn people out, but like, I don't know. That's kind of what I was thinking for if someone asked me to come up with like a protocol.
Yeah, I was thinking jumping jacks. Like, I mean, I, as far as the osteopathic manipulation and the chiropractic manipulation goes, um, I agree with you. Like, I don't have too much expertise on that, as I'm trained in neither. But also, like, mechanically and anatomically speaking, a healthy football player who's hunched over with a forwardly flexed thoracic and lumbar spine, like, they're not having some disease process in the spine that's really gonna like considerably inhibit the transduction of neurons of neural signals through their spinal nerves. Like, there shouldn't be any
I I think you're
discrepancy.
just saying like neural tension. And again, I don't I'm
Yeah.
totally speaking out of any area of expertise. So people can
Yeah.
certainly weigh in.
I feel less convinced that that would do much. Quite, I don't know if it'll do any harm, but I'm certainly not convinced it'll be terribly helpful. And I would say, like, we've both in our training have been involved in professional teams, and professional teams have access to chiropractors. Like, there are like team chiropractors.
Hmm.
So they still cramp. Like, whatever the solution we think might be the case, the professional NFL teams have already tried it and they still get cramps. So, um,
Let me
I
ask you
had
another
something.
thing. Oh, go
Okay,
ahead.
you might be going you might be going exactly where I was going to go.
No, this is not in left field.
Is that a left field? Okay, go with yours and then
Yes.
I'll remember mine.
All right. We in our college coverage, we used to do ice massage to a
Okay.
cramping muscle. And I also used to cover college hockey. And so I don't recall any um, significant cramping in the hockey players. Now,
Mhm.
this could have been that maybe I wasn't there for the beginning of the season or whatever. I was just a fellow. Um, but or maybe the fatigue level, is less when it's not as hot. Like maybe the heat part of it is just adding to fatigue, not, you know. So that was one thing. But like,
You
if you
you
made
took you actually went the same route that I was going to go.
okay, all right, well, go
Do you
ahead
know what
with
I
it.
was going to say? You know what I was going to
No,
say to add to your point because you brought up temperature. You brought up ambient temperature and that's what I was going to say as well. I didn't think about the hockey part and I agree with you. I actually when I've covered hockey, I don't ever remember seeing a single player with a cramp that had to be taken off the ice. So
hmm hmm
I was there for the begin. My hockey experience coverage was at the professional level, and I went to several games smattered throughout the NHL season, and I don't remember a single player on either team of any of the games that I was a part of at any point in the season that really struggled with cramping. Um, but to add to your point about the temperature, I distinctly remember two specific clinical scenarios. When a team that's not used to playing in Miami frequently travels to Miami to play the Dolphins, and they're not coming from a state that has a humid temperature year round, I feel like those athletes on the away team struggle with cramping when they're in Miami. And sort of related, I distinctly remember in the early to mid 2010s when the Miami Heat had the Heatles, they had Wade, Bosch, and LeBron. They're playing the San Antonio Spurs in the finals. And one of the games in San Antonio, the air conditioning went out. And the players, if I remember correctly, I feel like it affected the Miami players more than it did the San Antonio players, but they really cramped. I remember cramping was a big issue for all of the people on the Miami team. So
I remember that story. I don't know all the details, and there are some old stories about like back in the like Larry Bird, Magic Johnson days where wherever from Boston Garden or wherever that they purposely turned the AC off, to try to like sweat these boys out,
yeah.
So and cramping was an issue, so maybe that's where this correlation comes from.
Yeah, and the thing for me is like I don't think it's a hydration thing. I don't think it's like heat hydration. I think it's like core body temperature affecting either muscular metabolite clearance versus
Yeah.
neuromuscular adaptation.
Or like fatigue, like it's just, I mean, I think if you run a mile in an ice arena, or you run a mile in a humid room with no airflow, like you're going to be more fatigued just from a metabolic standpoint. I mean, I think it's hard to disentangle those two things, uh, fatigue versus dehydration, like, and you can be hydrated, right? Like we can test whether or not you were hydrated.
Mhm.
We can weigh you before, we can weigh you after. I think, um, and I think it's not, just to make this point, because I don't want people to read us wrong, is like we're not saying like hydration is bad, like you shouldn't
Yeah.
focus on hydration. Yes, you can definitely have, serious consequences if you're dehydrated. Your performance can drop as well. Your ability to think, make decisions, all that's affected. But is that the primary cause of exercise associated muscle cramping in kids? I just don't think so.
I agree. Like because the athletic trainers on these high school teams know that cramping is a problem and they've got the resources. They've got the know-how, they've got the expertise, they've got the pickle juice and the salt crackers and the Gatorade and the whatever else you need, and it's still happening. So I disagree. I don't want to say I disagree with the fluids playing a role. I think it's just like intellectually lazy that we just like anchor on its fluids and electrolytes. I think it's far more complicated than that. I think it requires a more protocolized approach. And it's not every sport, right? Like I don't see golfers that cramp. Um, it's not, I don't, I mean, what about swimmers? Do you feel like water polo players, divers, and competitive swimmers, do you see a lot of cramping when you are they complaining to you about cramping when they come to see you for problems? I don't know if you've covered any of their games.
No, I haven't really covered that, but I guess I would make the argument like it's if we think it's muscular fatigue, and then this rest period, and then this dysfunctional kind of nervous system afterwards, it just may not be that they have that situation that occurs. You know what I
Yeah.
mean? I think, yeah, I think that maybe we're not necessarily saying like, hey, this has to just be this huge paradigm shift, but it's just like we just got to think a little bit more about it than just saying like, this is the point I wanted to make earlier is like, I think why we're keep going down this road, at least in kids, is you know how it is. Like everyone just wants to be like, oh, well, it's a kid. They're not drinking, right? Like, no, like let's not just blame it on it being a teenager, right? Like there's other reasons for this to occur. And so, that's, I guess that wraps up for me what the points that I wanted to make to you and get your thoughts on it. I just think we have to be more curious and ask more questions.
Yeah, I would agree with you 100%. And the thing, we always talk about this when it comes to the kids versus the adults. I think you agree with me. Like, I hate giving diagnoses to pediatric patients that belong in the adult world. And I think it's intellectually lazy when we end up doing that. And I will actually tell the parents sometimes so that if I've done a thorough evaluation and I've discovered some disease process and I want to give a diagnosis, but I'm going to pick something that typically we see in adults and is not common in kids, I will tell the patient and the parent, I'm not happy with this diagnosis. I'm going to tell you what it is, but their physiology doesn't make sense for this. Let's pretend it's this and try to treat it like it's this, but I want to see you in close follow up because in case I'm wrong, I want to keep investigating what else this could be if it declares itself differently. And I think this is the same thing with whenever we talk about cramping in the sense that no, I don't think we should just blame it on kids are being kids. They don't know how to do this. They don't know how to do that. I think a lot of kids do know what to do and they are doing what they're being told, but I think the advice that they're getting is not perfectly accurate to the problem we're trying to solve.
Totally, totally. Yo, do you have time to switch gears a little bit? I got another topic that I'm interested, but if you got a
Yeah.
jet,
Yeah. Let's do it.
one of the things that I'm curious that you're seeing, so I didn't have a chance to look the data up, but so now in Arizona, I think for the last two years, uh, girls flag football is a sanctioned sport by the Arizona Interscholastic.